Hello again, and welcome to EDTalks. So today I actually was going to talk about new developments in either anesthesiology or pain management. And then I decided that maybe I just need to be a little bit truthful and realistic about how things are. When I was in residency back in 2006 or 7 or whatever it was exciting to learn about new developments in the field that you were in, especially in anesthesiology and pain management. Most teaching institutions allow you to go ahead and try the latest new thing out, or create a new way of doing things and really work towards improving the state of medicine. And so when I was a resident and we would read about this great new development, if it had enough data, we would go ahead and try it out the next day and try to see if it really was worth implementing and using it in our practice. But then once you leave academics and you start working in a non-academic institution, that kind of goes away, and trying out new things becomes cumbersome and burdensome. A lot of hospitals don't really want to change the way they do things, or they don't want to purchase new materials because it's expensive, or they're afraid if they try something new they'll expose themselves to lawsuits. So honestly, whenever there's a new development, I don't really get that excited anymore. Unless I'm at an academic institution or a private practice that really is interested in like dramatic change. But the average middle of the road practice or hospital, middle of the road, I'm not saying anything negative, I'm just saying that they aren't necessarily as rich or as willing to take risks. They can still be good, they're just not as well endowed as some other places. You're just not going to see the latest things. People are less likely to try out new things. And that kind of sucks, I think, for everyone. And so basically, unless you go to an academic hospital or a really high-end hospital, you're really not going to get the latest thing. And sometimes not getting the latest thing is also good too, because sometimes the latest thing is discovered to be not so good. But really the only places that are doing cutting edge stuff are going to be academic hospitals and the super high-end hospitals that have a lot of financial resources and are willing to take some risks. In the average private practice office, that's also going to be true. Your average doctor with a very simple practice is probably not going to be jumping the gun on a lot of new things the way a bigger group with more resources will. And so I guess that's why my excitement when new things come out isn't necessarily that high. Because you really can't jump on them as easily as I used to do when I was a resident. So hopefully things will change and we'll be able to move forward in medicine sort of the way we do with computers and technology, where change comes around quicker and faster and cheaper. But until then, if there's a new development, you're probably not going to see it at the place most of us will end up getting our care at for a really long time. Anyways, hopefully my next video will be a little more uplifting. All right, bye-bye.